Tenant improvement in occupied space challenges the best interior contractors. And nowhere is that challenge more demanding than healthcare facility renovation. Contractors need skilled interior systems mechanics with the right training for the job. And the United Brotherhood of Carpenters has stepped up to the plate with a rigorous training program for their most experienced journeymen. Installing the latest diagnostic technology, upgrading to new building codes. Modernizing utilities and occupied space is a top priority for healthcare facilities. At the same time, these users never lose sight of their primary mission: to provide their patients the safest, most risk-free environment possible.
We recognize the fact that those patients are there 24/7, 365 days a year, and we don't have the luxury of vacating the building in many instances in order to accomplish the tasks at hand.
Healthcare facility managers have rigorous guidelines for controlling contaminants during demolition and improvements.
As you can imagine, we're working now in an occupied existing hospital, immediately adjacent to surgical suites, to ICU, to CICU, and the need to be sensitive to airflow, to dust control, to infection control. It's just paramount to the success of the project.
To meet these standards, a specialized skill set, or best practices for hospital TI projects, was developed by the Carpenters International Training Fund. Contractors and carpenters alike knew that the UBC International Training Center could deliver the best practices skills training to match the can-do attitude of UBC interior systems mechanics.
The carpenters have a very, very unique and important job on this project. And they know exactly what they're doing. They're skilled in reading prints, they talk with one another, and they're always out there talking with the end users of those units to really help move the project along, so no surprises. And they're also very respectful. As I said, it's a hospital, and we have the public working amongst us all the time. And they've just been very professional.
Carpenters on this project and all our hospital projects perform all their tasks safely. The safety is part of the job that the carpenters do, not only in erecting this enclosure, but all the work that they do throughout the hospital.
When they come in, they're prepared to do the work. They know the procedures on how to keep dust down, how to set up their negative air machines, how to set up a hard wall feature, some soft wall plastic with the zip wall pulls. It makes the supervisory role in the carpenter foreman's life a lot easier when you have trained people come in.
HEPA is too big for the area.
Working with users, contractors, and environmental specialists, the UBC's International Training Fund is delivering the UBC's Best Practices qualification for interior systems mechanics throughout the United States and Canada.
They realized after we interacted that the containment to control those hazardous materials was really the skill set we were looking for. Hospitals truly are an environment of controlled hazards. Now we have an excellent training program that will be able to be given to the rank and file all across North America.
The Best Practices training program begins with the UBC's International Training Center. Here, Train the Trainer seminars are underway. During the 5-day program, trainers get a comprehensive overview of contaminants, hospital construction, and hospital administrative procedures for construction. Then, on the shop floor, they receive intensive hands-on instruction. Returning to their local training centers, they implement the Best Practices qualification program in the classroom and on the shop floor.
So we know what side we're going to work on.
Apprentices, journeymen, UBC foremen, and superintendents soon learn that working in a hospital is very different than the usual TI job. Building on their traditional skills, they gain a solid understanding of the new equipment used in the hospital environment. they master the use of HEPA equipment, biohazard PPE, enclosures, containment barriers, and other specialized equipment.
Long distance from here to here.
The Best Practices Qualification Program is about more than developing a new skill set.
I think we'll be okay with it. Okay, Larry.
It's about added value for contractors and end users.
And if it wasn't for the skill set that is developed by the carpenters, we would not be able to afford the safety measures that we're taking now.
The carpenters we've had on this job have done an excellent job. We're only as good as the people that we have working for us. And we look at them as partners in this process. And we're very pleased with everything they've done here.
Exposed or tearing something apart.
Healthcare facility managers can rely on UBC Interior Systems contractors and their specially trained and qualified crews for the skills, productivity, and professionalism essential in the healthcare industry. So when it comes to renovating healthcare facilities, the UBC's Best Practices training offers the assurance that your construction team is as professional and committed to patient well-being as the rest of your team.